I mean, I think that sex-disaggregated data is quite sexy. What's sexier than having data that represents all people and their unique experiences? But in all seriousness, I think that when a lot of people think about data, they think about numbers on a spreadsheet. And depending on how you feel about spreadsheets and numbers, you might think that's really sexy. But there's also a lot of people that might find that overwhelming or boring, or that it just doesn't relate to them. But that's really not a good excuse. And I think there's an opportunity to change people's minds, especially in light of the COVID-19 pandemic. It's been evident from the get-go of this pandemic that it was going to affect men and women's lives differently, not only in the immediate term, but also in the long term. And yet, 1 year later, we only know the sex of roughly 60% of all cases and 70% of all deaths globally. That means that the sex of 500,000 deaths and close to 40 million cases of COVID-19 are currently unknown. Lacking that information is going to make policy response very difficult, more difficult than it would already be in the face of such a global pandemic. And without informed responses from leaders, we are going to perpetuate inequities and potentially leave ourselves with even more issues than when we began. But the good news is that this is a preventable problem. We have the tools, we have the knowledge, we have the skills. Now we need to make sure that we have the resources and the motivation to change this.